Senator Hoeven.
Thanks, Mr. Chairman. Appreciate it. Thanks to all of our witnesses for being here and for all you do to keep us safe and take care of our men and women in uniform. I want to ask primarily about, well, first, some mental health issues and making sure that those services are available to our members of the armed services. But first, I'm going to ask Lieutenant General Miller about the cancer study that's being done in regard to actually, the chairman state the Malmstrom Air Force Base. There were a number of cancer cases there, and in response, the Air Force has initiated a study on it to determine cause, and of course, make sure that anyone that needs treatment is getting it. I did talk to General Boussier, met with General Boussier, the commander of Global Strike Command, to ask him about it. But my first question for you is, how do you determine that a case of cancer or a group of cases of cancer are attributable to any particular cause?
Thank you, Senator. And yes, there is an ongoing study now based on General Boussier's request, as he's been offered the initial assessment from our team at USAF-SAM, and he has elected to conduct a study that will be led by that team at USAF-SAM in cooperation with other important agencies, the VA, the cancer societies, and others. But what is going on right now is there's a 10-member team on the ground, just left F.E. Warren. We're at Malmstrom. They're headed to Minot to assess what each base is unique and different, what the situation is like in each area, how that study could best be done. Because to get to your question, it is a complicated question, especially when you're dealing with multiple different airmen, guardians, different career fields, different bases, different time frames, and even different cancer types to determine what might be involved, what the incidence is, and then, if possible, what might be a causative reason that we would then take action on, since our priority is the safety and health of our airmen and guardians. So this is a process that will continue to play out over the next 12 to 14 months as we take this very seriously and try to get to the bottom of some of these concerns.
Do you have any sense of timeline at this point?
12 to 14 months is a reasonable estimate. Now, the study will play out in stages, and obviously, as they get information, if there's something actionable prior to that, that will happen. In the same regard, certain paths may result in more work being done that could extend this out, but the key is timeliness and trying to get this completed as quickly as possible to best take care of all that might be impacted, whether active, retired, all beneficiaries. And once again, partnering with others like the Veterans Administration, understanding all that potentially could be impacted.
Thank you. The True North, Task Force True North, is something I've worked on with the chairman of this committee and also with Air Force leadership, Secretary of Air Force and so forth. In the initiative, the True North initiative, is there a concerted effort to make sure that you're addressing mental health care adequately across the missile bases?
Yes, Senator. That's a great question. And True North is the initiative that the A1 community in the Air Force is rolling out with the focus on mental health. In a mirror framework, SG has something called operational support teams that will be at Minot, that will be at every one of our 76 Air Force bases, knowing that our airmen and guardians, the two main reasons that they are often not deployable or have issues, it's mental health and it's musculoskeletal. So as a part of teams, 5-member teams that will be embedded in the med group, will go out to units for short periods of time, 8 to 9 weeks, develop trust, do prevention. Mental health will absolutely be a part of that effort.
And it's addressing family needs too, not just the service member, right?
And that's a great question, because family is equally important. OST is based on the active duty members. For the Air Force, we've created something called Developmental Behavioral Family Readiness Centers. So there are 8 hubs presently throughout the United States that will address. We know that there's quite a few children that are impacted by mental health issues, that these teams go out to bases on a quarterly basis and then support virtually from afar, so that a Wright-Patterson, for example, is a hub that could go out to a location like a Minot and provide that type of support. Those teams right now are focused on children, but could be expanded to include adult mental health providers that could take care of dependent family members that have mental health needs.
Well, with the indulgence of the chairman, one final question, and make it short, please. I am past my time, but both for Dr. Lester Martinez-Lopez and also for General Crossland, through TRICARE, are you providing enough mental health services and providers for our service members?
I'll defer to General Crossland.
So, sir, there's not enough in our country to meet the demand, to be honest with you.
I'm asking the question.
Yes, sir. So we're doing our best with the contract, and as some of our teammates have mentioned, taking a much more holistic approach, partnering with other teammates to help folks with their mental health, not just medical.
And it is a focus.
It is absolutely a focus.
Thank you. Again, thanks to all of you. Thank you, Mr. Chairman.
Just one quick follow-up on Senator Hoeven's questions is for you, General Miller. What role is the Defense Health Agency playing in the assessment that's that the Air Force is doing under General Bussier?
There is a partnership there, and we're in open communication, so the Health Surveillance Division, part of the DHA, is absolutely involved. So it's important to us that this is in all the key organizations are playing a role, like as I mentioned, VA, American Cancer Society, and others, with an interest that once a study is completed, we may need to have some civilian organizations to be involved to be another set of eyes based upon the results that we receive.
Thank you. We appreciate all of you, your testimony, your opening statements. Thank you for being here today. This was a helpful conversation, covered a number of topics, but our oversight responsibilities will not stop here.